but it's a very useful tool to reshape the nose. You can take big or small humps where you can do some resection and block resection. We can use that as a reconstructive graft.
Ladies and gentlemen, welcome to this episode of the Rhinoplasty podcast. It's our last episode in the month of May, which has proudly been brought to us by Vectra from Canfield Scientific, the awesome 3D photography system. And the last speaker in the month comes all the way from Mexico in the city of San Luis Potosi. And he was one of the speakers at the World Rhinoplasty Day, the last of the young guns. It's a great pleasure for me to welcome Dr. David Galzara to the show. David, welcome.
Thank you very much. It's a pleasure for me to be here with you, Cameron, and all the audience. We are going to, talk about some of the stuff we do here in Mexico with our, particular style. And I'm really grateful to be here.
So David, tell me, I've never had the privilege of being in Mexico. The closest I've come to Mexico is when you guys broke our hearts at the Soccer World Cup in 2010. When it was the opening game against you guys, and we scored such a great goal, and then the Mexicans came back and beat the South Africans, and it was such a sad day for us. But Mexico is a great country. I would love to one day come and visit you there. Tell me, whereabouts in Mexico is the city that you live in?
I don't go as far as 10 years ago when we played the World Cup. I mean, you have a very, very good memory. But, I come from San Luis, as you just said. It's a city right in the middle of the country. If you look at the map and you just point out the center of it, that's right where San Luis Potosi is. And, it's a city. It's not a big city. It's a 1 million people city. I mean, it's not so small, not so big. And we are around 1,900 about sea level. And we have a warm weather. I mean, it's a semi-desert type city. So it has, those characteristics. And we're very close, to Mexico City, but we are also close to the major cities like Monterrey and Guadalajara. And besides that, well, it's a well-connected place,
Oh, that's great. And you're very far away from that wall that Trump was going to build, eh?
Yeah, we're far away. I mean, but he's gone already, so
that's great.
There's someone in charge now, some other in charge.
Tell me your story as to how did you become an international board-certified facial plastic surgeon? Where did this all start?
Oh, well, I guess I will have to go back to my university days, because at the beginning I didn't know I was going to do otolaryngology after finishing medical school. This comes because I come from a family where my dad's it's a doctor, and also my grandfather is a doctor. However, both of them they are pediatricians. My grandfather and also my dad. So I got into medicine, I all I knew was pediatrics, and I was really looking forward to that because at the beginning I liked that, but once we were on medicine, I started looking at different things, and once I got into the surgical year where we see all surgical specialties, I really liked that. So it was like, this is my thing, I like to do some stuff with my hands, and it began like that. So once that I finished my internship, I really decided I wanted to do otolaryngology. And one of the main reasons was because I really liked the nose. I mean, inside and outside, to do rhinoplasties. I really focus on that. but also on the nasal sinuses, paranasal sinuses. I mean, it was something that I really liked. So that put me in otolaryngology, So after I finished medical school, I went to Mexico City to do my specialty, otolaryngology, head and neck surgery. And once I was like in second year, here we have a 4-year program. And around second year, I began, focusing on, of course, on rhinoplasty, studying a lot about it since I started residency. But also, I also started looking into facial plastics as a subspecialty. I really enjoyed all the different topics and areas of facial plastic surgery. So around third year, I really looked forward into to do a fellowship. So when I was in residency, still in residency, I wanted to see different surgeons, different techniques besides what I learned in residency, and I began to do that. Taking some free time of my own to learn more and see some other stuff. And I guess I always had that curiosity, to know more, experience more. And after I finished my specialty, I applied to do a fellowship in facial plastic surgery here in Mexico. And I was able to get one of the two places at the time. The three places. There were only three places like 10 years ago. There were no other place to do fellowships. So I was thankful to get in and to start fellowship with the Mexican University of National Mexican University called UNAM. So I did my fellowship, and that began pushing me towards that. So I think it's like a journey where once you are, on that train, you need to pursue and continue, to do more, not just for you, but also for others. Because I think the certification and the board, it's a thing where I believe all facial plastic surgeons, all people that have done fellowships, you need to do that to be standardized, around the world. So after I finished fellowship, I spent some time with Dr. Jonathan Sykes and also with Dr. Kit Laferriere. I don't know if you know them, Cameron.
Yeah, no, I do.
but the one that really, after I have already finished and all training, and I have been already in practice when I was visiting Dr. Kit Laferriere. He was the one that really pushed me. He was the one that really pushed me to begin the certification, to do the board test, the exam, and do all requisites that you have already done. So he was really the one that encouraged me to finish it off. However, I already had that idea, but I know I was a little hesitant about what to do it and when to do it. At the time, I had already started a family. I had a little young girl, so you know how it is when you start practice. It's not like it's an easy way to go. So I'm right now. I'm really happy to have done everything, but I mean it's really something that I really encourage all young surgeons to pursue, to do it, because as times go by, the certification is more and more important everywhere in the world. I mean, you look at not only medicine, but I mean in all other areas, and in business, in construction sites, in hotels, there's more and more international certifications. So as facial plastic surgeons, I believe we must be certified by high standards, and those highest standards are the board certification in facial plastic surgery internationally.
I can't agree with you more. It's brilliant. But so, David, the nice thing about it is that I think the thing that inspires me about your approach is that you want to teach as well. I mean, you were one of 3 fellows back in the day. But since then, I often bump into you at congresses and the European meeting in Amsterdam, for example, or in Orlando, etc. What is it that makes you want to grow more in helping other people in rhinoplasty and facial plastic surgery?
Well, I think that what makes me want to do that, it's it's not an easy question, but maybe what I'm looking for is to enhance the results of all colleagues here in Mexico, to have better results, to have more, to have our patients to be happier with their results, and also at the same time avoid those results that you and I come by every once and then, that are disastrous. So we as rhinoplasty surgeons, we really look forward to have happy patients, and not only our patients, but I mean the whole community, to have very good results and avoid those awful rhinoplasty results we have seen, in some television shows or on the internet or Instagram. So I believe that's the main thing that pushes me, to learn and also to pass along to other guys, younger
That's great.
generation.
So, David, tell me, before we climb into your topic for this evening, what are you doing when you're not working? Tell me a little bit about who David is when he's not in his scrubs.
Well, I like to take some free time. I'm a guy that really likes movies, so I like to go to the movie theater. I mean, here in Mexico, movie theaters are already open again, so I'm really happy about it. I'm an easy and relaxed guy. I like to go to the movies. I like to do some exercise. I mean, light stuff, not as you, but I like to do some some light exercise, And besides that, well, I really like to know, my I have different hobbies. One of them, besides doing exercise, to watch and follow some sports. I don't know it, but I think you're a very fan of soccer, or I don't know you. I'm not so fan. I follow Champions League, very closely, but I mostly follow American football. Do you know it?
Yeah, we play rugby. That rugby is the real game, We don't put pads on when we go into the field.
We have a lot of influence from our neighbor in the United States. So I really love football, American football. I also follow the NBA. I mean, I'm a big fan of those two sports, and also some others like Formula One. I mean, every Sunday I get up early just to watch Formula One.
Wow,
it's something I really enjoy.
Wow. And in your family,
but I mean,
how many children? You mentioned your daughter. Do you have any other children?
Yes, I have a child and a daughter. My girl, she's already grown. She's 12 years old, and my little kid, he's 9 years old. So they have grown a little bit,
Well, that's awesome. Well, thank you for taking time away from them to come and talk to us
So
today.
they surely, I mean, they take a lot of time from you, I spend a lot of time, in the weekends with them. I play with them. And besides that, well, time flies by.
Yeah. Well, let's get into the topic that you want to speak to everybody around.
Sure.
I would remind you that whilst you get your presentation ready, we have the podcast goes out on 4 or 5 different platforms. So there'll be many people around the world who can't necessarily watch it on YouTube. So I'd encourage you to explain it carefully when you do get to sections that people would normally be able to observe. Instead, they'll have to listen.
Yeah, sure. Of course. Well, let me share my screen. Let me know if it's working.
So whilst you're getting ready for that, I know when we were just chatting away, you're saying that you're slowly dabbling into the preservation rhinoplasty from structural rhinoplasty. So tell me a little bit about your journey of how you're getting there.
Well, as you know, or maybe you didn't know, or the audience, but here in Mexico, there are some very good surgeons that have been doing preservation for the last 30, 40 years. And they speak on the meetings, on our Mexican Society of Facial Plastic Surgery. They speak on meetings. However, I learned the preservation way from the start, and I actually didn't think about learning the push down or let down, and I didn't actually learn it. It's something that I must have done.
Yeah.
But I mean, I didn't look into it, and I asked some different surgeons about it, and they all told me, "Oh, that's old stuff. You don't need to learn that. I mean, you don't need to do that. I mean, there's new ways and better ways to do it, to manage the dorsum. So don't waste time going into that." And it is what it is. No, I never learned, although I knew the technique, not with all the details, but I knew about it, and I heard, I heard the talks, and but I mean, it didn't look something appealing to me.
Yeah.
However, once the preservation rhinoplasty meetings started, there was like something inside of me that was like, what is that? What I need to know about what they are talking about. And that's what it started it all, because I began reading some papers. I mean, there were not a lot, like 3 years ago, 2 years ago, actually. There were not a lot of papers about it. So I began reading something about it. And, after some thinking about it, and after meditating, I started doing some preservation, looking at videos, looking at meetings, asking questions, and that thing took me to start doing different techniques in preservation rhinoplasty. And right now, I would say that I'm shifting more of trying to fix the dorsum in a preservation way, not in a specific technique, because I like to try different ones depending on the deformity. But I like to try to do it that way, because I believe you can have better dorsal results in the long term. Because in the short term, I mean, if you do a good job, you can have a very nice result. However, in the long term, I believe you can have even better results doing some preservation of the dorsum. So I started shifting. I started doing small stuff, and began climbing it up, and do even tougher or bigger deformities. I began with straight nose, very small humps, and then I began doing bigger humps, higher humps, and also started doing some crooked noses, doing preservation, and I have really liked the results so far. I haven't still left the structural part. I would say that I do maybe 60% preservation, 40% structural on the dorsum, not the tip, but on the dorsum. And I began shifting because I really like the results I'm getting. I believe they have increased. I have increased the results in doing preservation in certain noses.
Well, that's awesome.
So
we're going to have a whole month of preservation coming up, but for tonight's talk, you're going to be speaking to us about the use of surgical burrs in rhinoplasty, eh?
Sure. This is something that I've been doing for quite a while now. Back in the day, when I was an otolaryngology resident, I told you already about all you guys. I already told you about my experience with rhinoplasty, but I really loved otologic surgery. I mean, it was something that I really liked, and I really love to use the surgical burr to do mastoids, and it's something that after residency I stopped doing it. I haven't done some mastoidectomy since then, but once I began knowing about the burrs that you can use them, I believe it's a very useful tool to reshape the nose, because even if you have a very sharp and a very nice chisels or osteotomes, I mean, you can have them in surgical steel, you can have them in ceramic, you can have them in tungsten carbide, but I mean, you don't have the precision that you can get with a burr. And I look at it like as when mastoidectomies were done with chisels, and I think that that maybe in a lot of years, 50 years or so on, our colleagues then will look at us and say, how were you doing rhinoplasties with chisels? I mean, you should have sculpted the nose, you know? And I really thought about that that analogy. I mean, in otologic surgery, why aren't we all using burrs? Because it's a very versatile instrument. So I'm going to speak a little bit about how I use the burrs. I know that the video is not very good here, but I mean, I can show you some pictures about it and how I do it. So I began using surgical burrs for some years now. I don't remember the exact date, but it's a very useful tool to reshape the nose, because you can take big or small humps, just like this one, where you can do some resection and block resection, and we can use that as a reconstructive graft, just like I show you here in the picture. This is a hump, a complete hump with a cartilaginous part, with the osseous part, and I use the drill, the surgical with a drill on the tip to make small holes, and we can use those to put it in as a septal extension graft. Just as you are all watching in the image, we can have, let me show you, just like that, as a septal extension graft. And we can do that in cases where we have a hump in some rhinoplasty surgeries that are secondary, and we have no more septum, but the patient doesn't want us to take some ribs, so we can use the hump in order to reconstruct the septum. and we can do it in this way, this manner. We also can do with these burrs, with other type of burr. We can, in this example, I'm going to use a small tip cover with diamond dust. So we can make very small resection. We can like polish the bones, and we can take very small pieces of it out, and we can smooth the dorsum, and at the same time we can lower it, and without doing, without having a lot of damage to the areas. So we can. The thing is that we can use different inserts depending on what we want. We can, as I told you here, we can use the drill to do small holes. We can use the diamond coated drill to polish. Let me see if the video works for all of the ones that are on YouTube. There you go. Here we are polishing, smoothing all the dorsum.
Yeah.
We can take, something as small as, 1/10 of a millimeter. We can take like 1/10 of a millimeter by a time, so it's very precise. Here we have another video. We can shape the nose. We can take out the places that we want to without damaging others or producing unwanted fractures. I mean, and it's something like ultrasonic rhinoplasty, where you have more precise cuts. You can have more precise technique in or more precise how you say it, like having it's a finesse work doing that way.
100%. So do you use any piezo instrumentation when you're operating?
No, I actually don't. I actually don't use piezo. I have a look into it. I have tried it. I have done some rhinoplasties with piezo, but I don't know if the tips that I have tried do not fit my way of doing the surgery. I have tried one for the dorsum, and I feel it's very slow. I feel it takes a lot of time to take it out, and I prefer doing this with the burr. I mean, because it's very quick. In 5 minutes, you can do all the dorsum, all the bony cap, or you can take out all the higher part of the bony dorsum real quick, and you can do that using aggressive burrs, just like the ones we use on ophthalmic surgery. I also use those to take out big humps, and it's very quick. And once I want to smooth out the dorsum, I can put the diamond coated burr and to smooth out everything. And I have done it with piezo, but I feel it takes longer on surgery. So I don't know if it's part of the learning curve, but I really like the way I can handle the drill.
So a question I have here is, what are some of the complications you find with using powered burrs?
I believe that the main...
perhaps I should rephrase that. What are the things people who want to use powered burrs in rhinoplasty should be careful of?
I think that the main thing is to be very careful in putting the drill where you should, because you don't have any protection if you slide to the side and some tissue becomes trapped between the burr and the handpiece. You can have a lot of damage there. So it's something that you must look at it all the time, and you must be very careful. I have not had it, but I mean, it's something that you need to look into it all the time, you know. And minor stuff. I mean, if you begin drilling without enough water, you can get the bone to be very hot.
Mm-hmm.
It can burn the bone, so we don't want that. So you need to be instilling water at the same time that you are drilling, and that's something that also, if you are having enough irrigation, you won't have any problems. And I would say that's the main thing. In the cosmetic area, in the aesthetic part, I mean, if you're not used to the drill, you can take out more bone than you would like to. I mean, if you are not careful, you can take out more. And the thing is that you cannot put it back in, because in resection, if you take it out and you think it's too much, you can, do a thin slice of it, and then you can put it back on. Here, if you just pulverize all the area, I mean, you don't have more bone to put there. So.
And David, what do you do with the bone dust?
Nothing. I don't do nothing because it's very, very small. I mean, all the bone dust. When we take out a big hump, I just irrigate it and clean it out. Mm-hmm. But when it's very fine, I mean, you don't even see it. I mean, it's like very small dust that you don't even see there. So most of the time, I would say I don't have to clean it out. Like, I mean, we always irrigate, but I mean, it's not like going back to the mastoid. It's not like you see a lot of detritus or a lot of bone dust there. So I actually don't do anything with it. Actually, sometimes if I have a big hump, I like to use the chisel to resect some the top part, and then with the surgical burr, I like to take out and smooth out the dorsum, the remaining part. So I actually don't get a lot of bone dust.
Well, that's great, eh? And
yeah, so
do you have some more examples?
There? Yeah, I'm going to show you another example, and then I can show you some cases. Well, this is a case where we did exactly that. We just used the diamond drill to smooth out the dorsum. We also did some cartilage preservation technique here, this crooked nose. And you can see the shape of the new dorsum, very smooth. And that's what I really like about this technique, that you can have very smooth dorsum, but at the same time, there's almost no traumatic part on our side from the instrumentation. And the good thing about this is that you can do all the work through small holes. You don't need to dissect a lot. And that's what I've seen some with piezo. I mean, I'm not an expert in it, and I don't have all at my hands. But the ones that I've seen, you need to dissect more because you have some curved hand pieces. So I prefer it. I prefer to do it this way. This is a close-up view of the dorsum. And also, we can take advantage of septal deviations and bony spurs, such as this. Once we take it out and it's very crooked, well, most of the times we don't do nothing with it, or we can crush it and put it back inside. But if we have a big piece, like the ones I'm showing, we can use that to our advantage. And we can work with the burr. We can work on that spur and change that spur into a straight piece of bone, like a plate, and we can use that in order to reconstruct the nose, or do the structural part of the nose. Here I'm going to show you how I begin taking some pieces out of the bone, how we begin drilling it. Here we are using an aggressive burr, or we can have some others where are not so aggressive. It depends on what we need to do. There you go. You can see how it's getting flatter.
Mm-hmm.
All the burr. Well, I mean all the spur.
No,
You can see
I
how it's
love
a
you
little bit
doing
more
this.
flat.
Suddenly, I feel like I'm an
And
otologist again, drilling some bone, and it can work so beautifully
you can
in
see some
various
other
grafts.
ones. This is smoother. This is not as aggressive. And we can do very fine work on it in order to make a small bone plate that we can use, as a septal extension graft. As I just show you, we can use it as a spreader. We can use it as a stabilization graft. I mean, there are different ways you can use it depending on your case. So we don't need to, just take it out and put it in the garbage can, And here's a case where we did exactly that. Let me show you. Here we change also the shape of the dorsum, smoother dorsum, better profile. We used that deviation that she had in order to straighten the septum on the inside, but also at the same time we did some dorsal preservation, but we're using the burr to take out the bony part of the hump. Here's a close-up view using the drills. Here's the result. Is it okay like that, Cameron? Or
yeah, it's beautiful. I can't help but notice your tip. They're really lovely. Are you using quite a lot of alar rim grafts?
Yes. I've seen that the tendency of most of our patients is to have weak cartilages, and weak on the septum, on the upper and lower cartilage. So we have very weak noses, so we need to strengthen them. That's why I have shifted, a little bit more to these new techniques, because I can save cartilage in order to do more on the tip of the nose, including other cartilages, including tip grafts, including septal extension grafts when we need them. But yes, I really like and I love the way that rim grafts work. How about you? Do you use them a lot, Cameron?
Yes, no, same thing, eh? But I don't. I like jump around between two of my great mentors were Spencer and Rick Davis, Spencer Koch and Rick Davis, and sometimes use an articulated one and sometimes using a free floating one. So I think it's just that little bit of finesse that makes such a difference on the profile on the sides here as well.
Sure. I mean, I use it more and more. The only limitation is that sometimes we get patients that only have like 1 square centimeter of available cartilage in order to do, the whole nose. So, in septal cartilage. So we need sometimes to take from other places. So every small piece of cartilage we can save, it's a plus for us and our patients.
So David, I'm going to kind of
at least that's what I do.
The bony stuff kind of, I think for me, what I found was great is when I was still a resident, I dissected 50 cadaver noses and measured up the lateral crura of the lower laterals. But I think if some of the junior listeners on the podcast want to be using powered instruments in the nose, I think it's very important to get into the cadaver lab and practice on the cadavers before you're actually doing in surgery. Eh?
Sure. I mean, I believe it's a must because, it's a very nice instrument, but it's not safe in untrained hands. It can be disastrous if they began using it, because if they do over resect, with doing these power drills, well, you don't have any tissue to pull it back up and reconstruct. But I mean, I believe it's really useful, like in this case where, you know, let me. Am I showing my screen?
Yes.
Oh, okay. Like here, where we have a very weak septum. Sorry, we have a very weak septum that it's crooked. So the bony part, I show you here, the bony part is already thinned out, and I also have done some small holes in order to pass my needle with the sutures, and we can do a very straight dorsum, like you can see here in the picture, and also we can use that in order to put some septal extension graft, and you have a better and more stable nose at the same time. So we can use the deflection to our advantage. But it's something that I believe that in all noses where we don't have enough cartilage, we need to look at it. I mean, it's a powerful tool. Although, as you just said, it's not for everyone. I believe that it takes a learning curve, and also you need to do some lab work before you try it on patients.
Yeah, well, David, thank you.
I'll show you one last case of before and after using what I just showed. You can see the 3/4 view, the profile view. Tips like this where they are all the way down, there's no support, there's also a lot of there's not so much cartilage, you have a hump. Well, you need to take advantage of all small pieces of bone or cartilage that you have at your hand. So here's the pre and the post-op view of my lovely patient. So I believe it's something that we can have in our arsenal. I mean, it's not a must that you do it, but I will say that I use it quite often. I bring it with me to the OR all the time, and it's something that I have become more and more dependable on to do my rhinoplasty surgery.
Well, awesome, man. David, thank you very much for that. So,
what
before I
you?
let you go back to work,
Sorry?
I have started to use piezo much more. So I use powered instruments when it's necessary. I try and not necessarily limit myself to one thing. So we actually have bought a piezo for the new hospital. So I've been using it around the country. We haven't had one in Port Elizabeth yet. So I'm very excited. 9 weeks' time, I've got my own piezo, and it's going to be great. So what I want to ask you as a parting shot, what will you say are the 3 most important things for you in rhinoplasty that you'd want to share with our listeners?
The 3 most important, I would say, the first, I believe it's to talk with our patient, to really know what he or she are looking for, and to take it from there, because there's still a lot of I think that the most difficult part in rhinoplasty is to have our patients happy, and actually that's what we must look forward to achieve. So we must talk with our patient, we must really know what they are looking for previous to the surgery, and we need to have a very good communication with them about the whole process. I would say that's the first. The second, I would say that the most important is to be up to date. I mean, it's this area is changing every day. I mean, it's awesome how what we're speaking right now, well, 2 years ago, it was something that didn't even exist. So I mean, it's like a roller coaster. I mean, it's very fast. So I think we must be prepared. We must be up to date all the time. We need to look into that. And the third, let me think about it. The third, I would say that learn. I would say it would be to share our experience and knowledge with others, as well as learn from our colleagues that have been doing different stuff, because we all do different things. However, it's always important to see their perspective and also to see compared with you, and you can do amazing stuff once you do that. So, and as I mentioned earlier, I mean, it's our duty to teach the new generations that comes after us.
Well,
I would say those are my three.
thank you very much. And this brings us to the end of this series on the young guns from some of the rising stars of rhinoplasty around the world. And I really want to thank you for your time. Obviously, a big shout out to the Vectra guys from Canfield for bringing this series to us. And I'm very excited to announce that in the month of June, we have the American Masters coming up on the Rhinoplasty podcast. So you better be tuning in, because you're going to be listening to the likes of Dean Turiomi and Rod Rorick and Rick Davis and Peter Adamson. So we're really looking forward to that. And then we'll be moving across to Europe, because we've spent a lot of time in the western part of the world. We want to now move over and start seeing what's happening in Europe and on the other side of the ocean. But David, honestly, from my side, thank you very much. And on behalf of all the listeners from all around the world, we appreciate the fact that you've taken time off your practice today. And also thank you again for your involvement with the Rhinoplasty World Rhinoplasty Day last year. We really thoroughly enjoyed having you as one of the presenters from Mexico. So I really hope and pray things go well for you and for your family. And thank you for today again.
No, thanks again, Camera. I mean, World Rhinoplasty Day was an amazing idea, and you can follow it up with the Rhinoplasty podcast that it's already a success. So I'm really happy to be here with all of you and be here with Cameron, and I really enjoyed this talk. So thank you very much, and I'll look forward to seeing you live once we can get back on our regular meetings, and also to see you all at the next meeting, hopefully.
Awesome.
All right.
Thank you very much. And thank you to all our listeners for listening. Please make sure that you spread the word. Tell your friends about the Rhinoplasty podcast. Go onto the YouTube channel if you want to watch it on video, or you can just download it and listen to it on Spotify or Google or Apple, various platforms.